Did you know that some of the medical tests you've been getting for years might actually be increasing your risk of serious health problems? I'm not talking about fringe medicine or conspiracy theories. I'm talking about peer-reviewed studies, published research, and real patient stories that reveal a truth most doctors won't openly discuss with you. Picture this. You're over 70, feeling pretty good, going about your life. You visit your doctor for a routine checkup, and suddenly you're scheduled for scan after scan, test after test. You think you're being proactive about your health. You think you're doing the right thing. But what if I told you that nearly 4 out of every 10 medical tests done on seniors lead to treatments that weren't needed in the first place? Treatments that come with side effects. Treatments that can spiral into complications you never saw coming. And here's the part that'll really shake you. One of these common checkups is now linked to causing as many cancer cases as drinking alcohol regularly. Yes, a test meant to detect disease might actually be creating it. Today, we're diving deep into 5 medical tests that you should seriously reconsider after hitting 70. These aren't fringe procedures. These are the ones your doctor probably recommends without hesitation. But the science tells a different story, and it's time someone shared it with you. Before we get into the specifics, I'd love to know where you're tuning in from. Drop your age in the comments and tell me, have you ever regretted getting a test done? Do you think older adults are being over-tested in today's healthcare system? I'm reading every single comment and responding with insights tailored just for you. And hey, if this information resonates, hit that like button and subscribe so we can keep bringing you content that actually matters. All right, let's jump into the first test on our list. It sounds innocent enough, but the aftermath can be anything but. Starting at number 5, we have the bone density scan. Now, on the surface, this seems like a no-brainer. Quick, painless, no needles involved. You go in, lie down for a few minutes, and walk out knowing whether your bones are strong or brittle. Simple, right? Not exactly. Here's what they don't tell you at the clinic. Once you cross 70, especially if you're a woman, that bone scan is almost guaranteed to show reduced density. But that's not necessarily a red flag. It's just what happens as we age. Your bones naturally lose some density, just like your hair turns gray and your skin develops wrinkles. It's biology, not a medical emergency. The problem starts when that scan result triggers alarm bells. Suddenly, you're prescribed medications like bisphosphonates, which are supposed to make your bones stronger. But these drugs come with a laundry list of side effects. We're talking about jawbone deterioration, severe digestive issues, and in some cases, bones that become so brittle they break in unusual patterns. Now get this. Research following over 1,200 women past 70 found that these bone medications reduced fracture risk by a measly 0.3% after 5 years of use. That's almost nothing. But the women taking these drugs? They were far more likely to suffer from painful side effects than they were to avoid a broken bone. Let me tell you about someone we'll call Rose. She was 76, a retired piano teacher who walked every single day and had never fallen or broken anything. After a routine checkup, her doctor sent her for a bone scan. The results showed mild bone thinning, not even full osteoporosis. But within weeks, she was on medication. 3 months later, she couldn't play piano anymore because of jaw pain and brutal acid reflux. When we finally saw her and took her off those meds, we focused instead on vitamin D, gentle resistance exercises, and a diet rich in calcium from real food like sardines and leafy greens. A year later, she was back performing recitals, her balance was better, her legs were stronger, and she hadn't broken a single bone. The point is this: if you're not falling, if you're not breaking bones, then lifestyle changes beat medication hands down. Strength training, balance work, and proper nutrition have been shown to cut fracture risk by over 20%. Don't let a number on a computer screen terrify you into taking drugs you might not actually need. But there's another scan that can lead you down an even scarier path. Let's talk about brain imaging next. Coming in at number 4, we've got the brain MRI for memory loss. When you start forgetting names or misplacing your keys more often, panic sets in. Is this Alzheimer's? Is this dementia? So your doctor orders an MRI to take a detailed look at your brain structure. And that's where things get complicated. Most MRIs done on people over 70 show what doctors call age-related changes. A little shrinkage here, some white spots there. But here's the kicker. These findings are completely normal in older adults. They're not signs of disease. They're just signs of time passing. But once those spots appear on the scan, fear kicks in. More tests get ordered. Sometimes even invasive procedures like spinal taps or biopsies. And all of this is based on findings that, statistically speaking, mean absolutely nothing. A major study reviewed 3,000 MRI scans from people aged 70 to 85 who had mild memory complaints. 86% showed some kind of brain abnormality. But only 3% of those findings were connected to something that could actually be treated. That means 97% of people went through the emotional ringer of hearing something's wrong when nothing really was. Think about George. He was 74, sharp as a tack, but worried because he forgot names sometimes and misplaced his keys. His doctor sent him for an MRI. The scan showed white matter changes. George panicked. He stopped driving, stopped going to church. His whole world shrank because of fear. But when we tested his actual cognitive function using a simple screening tool, his scores were totally normal. Those MRI findings? Just part of getting older. We focused on better sleep, staying hydrated, and keeping his brain active with puzzles and social interaction. Within 3 months, his memory stabilized and his confidence came roaring back. Unless you're having seizures, sudden personality changes, or rapid functional decline, an MRI for mild forgetfulness is usually overkill. A simple cognitive screening test is cheaper, less stressful, and just as effective at spotting real problems. Now, brace yourself. The next test is one you've probably had multiple times without questioning it. And number 3, we have the cardiac stress test. This is the one where you walk on a treadmill or get medication that makes your heart work harder, all while monitors track how your heart responds. It's meant to detect blocked arteries. But for people over 70 who don't have obvious heart symptoms, this test often creates more problems than it solves. Here's why. The accuracy drops dramatically with age. In adults past 70, the false positive rate can hit 40%. That means 4 out of every 10 people get told there's a heart problem when there isn't one. And once that alarm goes off, you're sent for more tests. An angiogram, maybe even stent placement or bypass surgery. A massive study found that more than half of all stents placed after stress test referrals were done on patients who had no real symptoms and saw no benefit from the procedure. Zero improvement in survival. Zero improvement in quality of life. But plenty of complications. Bleeding, kidney damage from contrast eyes, extended hospital stays. This happened to Raymond. He was 75, walked every day, felt great. But during a checkup, he mentioned feeling tired on hills. His doctor ordered a stress test just to be safe. The results were inconclusive, so they did a catheterization and found mild narrowing. A stent went in. That night, Raymond had a bad reaction to the dye, and his kidneys took a hit. 6 days in the hospital. Weeks of follow-up care. And the fatigue? It never changed. He was just a guy who needed better hydration and more rest between meals. If you're not having chest pain during activity, shortness of breath when you exert yourself, or a major drop in energy during light exercise, then a stress test might do more harm than good. A resting EKG or a coronary calcium scan are safer alternatives that give you valuable information without pushing you toward unnecessary procedures. Moving into the number 2 spot, we've got colonoscopy. Yeah, I know. You probably didn't expect this one. But hear me out. After 70, especially after 75, routine colonoscopy screening becomes questionable unless you're having specific symptoms. The preparation alone is brutal. Strong laxatives that can dehydrate you, make you dizzy, or strain your kidneys. The sedation carries risks for older brains. And the procedure itself can cause bleeding, tearing, or heart rhythm issues. A study following over 1 million Medicare patients age 70 and older found that for every 1,000 colonoscopies performed on people over 75, only 2 lives were saved. But more than 20 people experienced serious complications. That's a 10-to-1 risk-to-benefit ratio. Not exactly reassuring. Dana was 73, ran a bakery with her daughter, felt fine. No symptoms. no family history of colon cancer. But her new doctor insisted on a screening colonoscopy. During the procedure, a small polyp was removed. That night, she experienced severe pain and fainted. Turned out she had a bowel perforation. 9 days in the hospital. Lost 10 pounds. Her recovery was long and hard. And when we reviewed her records, we found she'd already had 2 clean colonoscopies in the past. There was zero reason to do another one. The U.S. Preventive Services Task Force recommends stopping routine colon cancer screening at 75 for most people. If you're in great health, a stool-based test you could do at home is often safer and still catches most concerning cases. No prep, no sedation, no hospital. And now, the moment you've been waiting for. The most overused, most dangerous test on this list. At number 1, we have annual full-body CT scans. These are often marketed as premium preventive care, a way to catch cancer before it becomes a problem. But here's the reality check you need. These scans expose you to massive amounts of radiation. Each one delivers the equivalent of 500 chest X-rays worth of radiation. A recent study found that the increase in CT scans may now be responsible for up to 5% of all cancers in the United States. That puts them on par with alcohol as a cancer-causing factor. Let that sink in. A test meant to prevent cancer might actually be causing it. Full-body scans almost always find something. A tiny nodule, a small calcification, a harmless cyst. But once it's spotted, the machine starts rolling. More scans, biopsies, panic. And for older adults, those findings are usually just normal aging. Marcus was 80 years old, taught martial arts, felt fantastic. He signed up for an elite health screening at a private clinic. His full-body scan showed a 3-millimeter lung nodule. That triggered a referral to oncology, then a PET scan, then a needle biopsy. The nodule was benign, but the biopsy collapsed part of his lung. 2 months of recovery, all for something that should have been left alone. The American College of Radiology is crystal clear. There's no proven benefit to full-body CT scans for general screening. Only significant potential for harm. If you have symptoms like unexplained weight loss, coughing up blood, or visible swelling, then targeted imaging makes sense. But scanning everything without reason is like playing health roulette. So there you have it. 5 tests that might seem helpful, but can actually cause more problems than they solve, especially once you're past 70. Modern medicine is incredible, but it's not infallible. Sometimes doing less is actually doing more for your health. Always ask your doctor, what happens if this test finds something? If the answer is vague, or if the risks outweigh the benefits, it's okay to pause and reconsider. Real prevention isn't about endless testing. It's about staying active, eating well, sleeping deeply, and making informed choices about your care. Now I want to hear from you. Have you or someone you love dealt with complications from a test or treatment that turned out to be unnecessary? What was your experience? Drop your story in the comments. Let's start a conversation that could help someone else avoid the same situation. And if this video opened your eyes to something new, smash that like button and subscribe so we can keep bringing you the truth about health and wellness. Thanks for watching. And remember, your health is your greatest asset. Protect it wisely.